Hi, today we're going to pick back up on tissue healing, but before we learn anything new, I'm going to touch base on what we learned yesterday. Yesterday we learned the 3 phases of soft tissue healing. Remember, soft tissue is skin, muscle, ligaments, tendons, or cartilage, not bone. So, going to our slides, the first stage of the soft tissue healing is what we call acute inflammatory. And remember, in the acute inflammatory phase, we've had an initial injury, blood rushes to the area. It brings with it some special cells that are helping to kind of contain the injury. We've got the phagocytes that help to eat up the dead tissue, and we've got the leukocytes, which are our white blood cells that help to fight off any infection that might occur. Okay. I did draw a picture. Be gentle. You guys know my artwork is not the greatest. Okay. And this is just showing my little cell. Okay. It's showing that my little orange phagocytes are in there eating up all the bad tissue. There's the leukocytes that are in there fighting infection. And remember that when we have the injury, the new blood is bringing oxygen, and that's going to help keep our other tissues from dying. Okay, remember that the first phase of this acute inflammatory phase is only going to last for a couple of days, depending on how bad our injury is. The second phase that we learned about yesterday was the repair phase, and in the repair phase, we kind of have a different set of cells coming in. The repair phase is kind of like putting a band-aid on the injury. It's a quick fix, trying to keep further damage from occurring, but it usually is involving a whole lot of different cells going on there. And so yesterday we talked about the fibroblast and we talked about fibroclast. Remember, anytime you see the word fibro, it's talking about soft tissue. Okay, which is very important because when we learn about bones, it's going to be completely different. Okay, so with the fibroblast, remember B for blast, B for build up. So fibroblasts help to make new soft tissue, whether it's a new ligament, a new bone, not a new bone, a new ligament or a muscle or a tendon, anything like that. Okay, and fibroclasts are in there and they eat away the dead tissues. So together we have fibroblasts and fibroclasts that work together in order to kind of make sure our injury is healing in the best way that it can. And again, another picture. So we have on my picture, I've got my B's and my C's, okay? And those are showing my different fibroblasts and my fibroclasts, okay? With that being said, that they are just kind of thrown in there in the mix, trying to put a band-aid on it, just trying to get it to heal and not have any further injury. Okay, it's kind of a quick fix. Okay, this process can take 6 weeks to 3 months, but it does depend on the injury. Remember, yesterday we talked about paper cuts. I don't have a paper cut problem for 6 months. Okay, so it just depends on how bad. Okay. Our third phase is the remodeling phase. Okay, this is the process where we go from the messy Band-Aid fix to our permanent fix. Okay, we talked about your scars yesterday, how your scars have changed over the year. They might have started out red, all right, or larger, and then now over time they've become white or a lot smaller and a lot less noticeable. Okay, so again, with the phase 3, you can see that the tissue is changing. Okay, you guys, the pain goes away and you start to end up having a whole lot better range of motion. So for the remodeling process, okay, we go from the messy Band-Aid fix through exercise, through the different collagen fibers that are in the area. You go from the messy to the organized. Okay, and this is where our scars start to change into less noticeable. Maybe the injury is able to move a whole lot better. Okay, and all that is the collagen fibers going from the quick fix that's in the repair phase, that Band-Aid, to the nice smooth collagen fibers that make it a whole lot like the original tissue. Okay, and that's what we covered in the first three phases of the soft tissue healing. Okay, um, we are going to pick up on the factors of healing. Okay, remember that there are different things that are going to play different roles in how somebody heals. Okay, yesterday we talked about blood supply. If somebody doesn't have a great supply of blood, then it doesn't bring that nutrients in. If they have bad circulation and that kind of stuff, how bad the injury is going to be is going to play a role. If the athlete is older, okay, an older person versus a younger person, the older person's going to heal slower. And any type of infection that's going on in your body, or if you're on certain medications, those are all going to play a role in the way your body heals. Okay, next we're going to talk about the different types of soft tissue in our next set of slides.